Hi, Maddie. How you doing?
Hi, Dr. Justin. How's it going?
Doing good. So what's going on with your body?
My neck and upper back are a little sore.
Let's just take you through a quick range of motion. Let's bring your chin all the way down here. Good. Now, does that pull on this at all?
Kind of more on the left side.
Left side. And then let's go up towards the ceiling. Good. You go any further back. Good. Does that cause any compression? Just here, tightness?
Yeah.
All right. And then let's rotate this way. Bring your chin down to touch your clavicle. And what do you feel with that?
Tight on the left side,
Left
in the back.
side. And let's have you come this way. Rotate, and then bring your chin down. And was there any tightness on that side as you went this way?
Yeah, on the
Still
left side.
Still on the left side. Okay. Let's just do some palpation on your neck and see how it's going. All right, ready? All right, so we're just gonna walk up the spine. Just kind of see how it's all moving. Yeah, so as we get right here, this moves kind of some stuff on this side more. Now, is this tender up through here or not? Not bad.
Yeah, more on the right side.
So as we go into extension here for C3, that's where it feels most locked up. 2 as well. Little lateral on that C1. Let's give you a little adjustment. We're just gonna rotate here. And traction all the way up. Lock that out right there. Good. Inhale through the nose. Exhale and let this all go. Good. Excellent. Here. This one feels a little lower at C5, 6. We're just going to rotate. Traction. Yeah, right there. Excellent. Yeah, how'd that feel?
Really good. Yeah.
Let's have you lie face down. Let's check your mid back. So something a little right through here. Ooh, there's a little rib adjustment right there. This is a little locked up. We're gonna do an anterior dorsal right through here, T8 to T6. Take a deep breath in. Exhale right through here. Good. There we go. Yeah. How's that feel as we're going up and down now?
Feels a lot better. It doesn't hurt anymore.
All right. We're gonna bend this knee. We're gonna get a little rotation in the upper thoracic. So I'm gonna take this. Put this right here. Good. Tuck this hip. I'm gonna bring this over here. Good. Good. Deep breath in. Exhale. Good. Right there. Nice. Bend this other knee. Inhale. Exhale. Good. Bring both legs out. I'm just gonna do a little hip distraction. For that. There we go. Good. Arms up towards the ceiling. Tuck the chin. Good. Interlock your fingers, put them on top of my hands. Elbows down. Inhale. Exhale. Good job. Well done. How'd that feel?
That was great.
Yeah.
Thank you.
You're welcome.